Wonderful. Great. Well, I'm John Evans. Nice to meet you all. And it's late. I'll try to get through this really quickly. There is a program overview presentation that's available on YouTube. This is not going to be that. That's already available to you as you're researching these programs. You'll see a lot of these presentations have already been given in some capacity. So I decided to switch it up a little bit this time. I just wanted to just kind of focus on parts of what I think are most important to you, which are one, are you going to apply to the program? One, are you two, are you going to are you going to signal the program? And three, if you're not, what are the reasons why you shouldn't? I think that was the hardest thing for me is trying to sort out all these programs. You'll see that the requirements for rotations, the call schedules, everything looks pretty similar in a way. Everything kind of blurs together. We are kind of bound by ACGME, so you'll see similar rotation schedules, relatively similar call schedules. Residents generally love their time in PM&R, so that doesn't help you out too much. So I'm trying to find ways to help you and trying to find ways to help you decide whether you're excited about the program or if you're going to pass. So one of the ways that I find that Mayo Clinic is very strong is clinical exposure. And I'm going to start with Brooks because I think this is the part of our program that not as many people know about. And since this is probably the most awake I'm going to get you, I'm going to start with them. So Brooks it's been around for over 50 years. It's one of the largest inpatient rehabilitation units in the country. We don't have an inpatient rehabilitation unit at Mayo Clinic. We have a very strong inpatient unit, but not a rehabilitation unit. And the reason why is because we have a very, very strong inpatient rehabilitation unit just down the road from us. So we've decided to collaborate with Brooks Rehabilitation for that reason. So they're the #1 ranked rehabilitation center in the state of Florida, and they're quickly ascending the ranks. Really, the only thing that's lacking from them becoming one of the top national programs is a training program, which we now have. They have an excellent mix of medically complex patients. So it's not common to find the complexity of cases that you see at Brooks Rehabilitation, in part because they get our medically complex patients that we have at Mayo Clinic. We have a high volume of second opinions for transplant, cancer, neurological disease, orthopedics, and Brooks is the primary inpatient rehabilitation unit for our patients. And not only that, but they get all the local polytrauma. So not only do you get medically complex patients, but you get a lot of traumatic brain injury, spinal cord injury. So for those reasons, that's just part of the reason why they're the #1 ranked program in the state. So it is a requirement to do a PEDS rotation, but you'll see it's not necessarily a requirement for that rotation to be taught by a PEDS PM&R doctor. So we're fortunate in that we have both inpatient and outpatient exposure to PEDS rehabilitation. They have a very strong dedicated research wing, a lot of adaptive equipment. If you go to PM&R, AAP, they always have an awesome booth where you could go get some popcorn, refreshments, and they'll demonstrate their adaptive equipment. Very impressive stuff. And also an exceptional adaptive sports exposure. I'm going to show you a picture here in a little bit, but if you go to their website, they'll actually have a calendar, and you'll see most days of the week they actually have some sort of adaptive sports that you could actually cover. It's a great opportunity, and it kind of goes alongside our MSK exposure and our sports coverage that we have at Mayo Clinic. So here's home, Mayo Clinic, Florida. So this picture on the right, it's actually a little bit different now because we've actually expanded our hospital. It's now about going up to I think 14 floors. So we have over 400 beds now. We've expanded the building on the right is like a cancer research wing. We've expanded that as well. We've also built a gym since this picture was taken. But it's a state-of-the-art building, and we get a lot of second opinions throughout the region for patients that are looking for answers that they didn't get anywhere else. We have a lot of international patients that come to see us as well. So you spend your internship year at Mayo Clinic, Florida before going to PGY2 and going to Brooks for the most part. And then you do your inpatient consult service and your outpatient rotations with us as well at Mayo Clinic, Florida. So #1 ranked hospital by Newsweek, state of Florida. So this is really where we stand out. So we get just a ton of second opinions for transplant, oncology, and neurology. So, and we're kind of the tip of the spear when it comes to MSK complaints. So it's not uncommon for me or one of my colleagues to see a second opinion from a renowned institution from their rheumatology department or neurology department, and there's something in the gray that they're coming to see PM&R. PM&R is like the entry point. So one of the things I often hear by as a complaint of our specialty is that we don't do as much diagnosis as some other specialties, and we do mainly management. Not true of Mayo Clinic Florida. We do a ton of diagnostics, and we're actually a very important part of the clinical decision making here at Mayo Clinic. We also have a very strong electrophysiology course in EMG. I'm just going to touch on that in a little bit. And it wouldn't be Mayo Clinic unless you had a strong ultrasound course. So this is Dr. Rubin. So he's wrote some chapters for PM&R and really other books. He's written his own book on EMG. He runs the EMG lab. We have a very strong electrophysiology course. It's a 6-month course. The first month, you're like essentially like a medical student all over again. You're learning waveform recognition, auditory recognition. You're testing out, you're practicing, learning about neuroanatomy. By the time you get done with your first month, you have a very strong working knowledge of the basics of electrophysiology and peripheral nerve disease. And then you start ramping up. You actually get into the lab, and it's an ALS center. So you're doing ALS cases, myopathy cases, complex cases throughout the day, and you're doing a very high volume of these types of cases. So we have a rotating curriculum for ultrasound where we're doing diagnostics. Essentially, by the time you leave, our goal is for you to be a sports medicine level trained diagnostician when it comes to ultrasound. We have a very high volume of ultrasound guided injections, and not just that, but because we have all these second opinions from orthopedics, which is a renowned orthopedics department. We get complex cases that just aren't seen very often. I'll still get a case every once in a while that I've never seen before, and just because there is just so many potential injections out there, and our residents will have access to all of them. And you'll also learn that ultrasound is not just a way to guide needles. So it's actually a diagnostic tool that's used throughout our building, and you get exposure to all these different ways that ultrasound are used. So you learn not just how to guide a needle where it needs to go, but you actually learn to use it as a clinical tool. Our pain department will use it for nerve blocks. Our rheumatology department will use it for assessment of synovitis. EMG uses it for diagnostic criteria of carpal tunnel and other compressive neuropathies. So you learn to use it as a tool and more than just something to guide needles to their location where you want to inject. So here are our residents. So you can see there's 4 of them, and this is 2 classes worth. So we only have 2 residents per year, very small class sizes, and because of that, a lot of one-on-one attention, definitely. So they're going to be giving this talk next year. But they're PGY2s right now, so I gave them a break and decided I was going to give this presentation tonight. So the reason why I work at Mayo Clinic and why I trained at Mayo Rochester and why I decided to stick with Mayo, this is the reason. And it's really hard for me to explain to you. It's something that I think you have to live to truly appreciate it. I think in general, PM&R doctors are nice. They're easy to work with. PM&R residents are happy. I think where you see the differences are when you move outside the specialty. What does the typical orthopedic surgeon look like that you work with, or the neurosurgeon or the rheumatologist? Are these people that are going to be invested in seeing that you are going to get great training? And the answer here at Mayo is absolutely, because the needs of the patient come first. So it's an ethos, it's a way of life. Pretty much everyone in the building, whether it's the custodial staff, everyone that works in this building is dedicated to patient care and seeing that our patients get the best possible care. So it's amazing. Even as a resident, you call over to a neurosurgeon. They give you the time of day. They try to teach you along the way. It's a different environment. It's just truly difficult to explain unless you experienced it. So along with the basic, curriculum of anatomy and going through all these different rotations, doing ultrasound, doing EMG, we have different pathways, which, we actually have one of our residents, the PGY2, that's going through the clinical innovation and entrepreneurship program right now. He's actually working with our engineering department to create his own adaptive equipment. We have resources here and programs and pathways here that are just not readily available elsewhere. They're all optional, completely optional, but sometimes they're very helpful in helping you achieve your career goals. So you can see we have a lot of internal fellowship programs. And fortunately, we have a lot of very strong internal fellowship programs in the specialties that are actually competitive. So pain and sports are our two competitive specialties, especially when it comes to competitive pain. And then pretty much all sports programs these days are pretty competitive. Fortunately, we have very strong programs, and it's a big advantage to have internal programs, not only to have the ability to match into these programs for fellowship, but also for letter writers to have exposure. So even if you do decide to go elsewhere, which is very reasonable to get training elsewhere other than where you trained, it's not a bad strategy. Well, you'll have the recommendations from renowned people in the field to be able to help you get into these other places. And as far as employment, your next employer, it might not be a PM&R doctor. And that's true of most of us. Most of us are not employed by a PM&R doctor. It could be a family practice doctor, an administrator. It doesn't matter where you work. They're going to know they're going to know what Mayo Clinic, they'll know the name, they'll know the quality. And this is the same for fellowship. If you're going to be applying to a family practice sports medicine program or anesthesia-based pain program, they may not know all the PM&R programs in the country, but they will know what Mayo Clinic entails, and they'll know the quality. So you could see Jacksonville, Florida. We're actually in the northeast portion of the state. You could look a little bit lower on the map, and you can see Orlando. Tampa is a little bit further away. Orlando is a day trip. That's about 2 hours. Or Tampa is a little bit further. It's about 3.5 hours or so. The truth is, people rarely leave because they don't really need to. We have everything here. We're the most populated city in the southeast, believe it or not. There's a lot of entertainment here. There's very little reason to leave unless you want to see Mickey Mouse or Harry Potter every once in a while. So we're situated on the St. Johns River. This is the downtown area. We're a little bit south of there. We're probably like 25, 30 minutes southeast on the beach away from downtown. So this is Mayo Clinic, and I want to reinforce just how awesome this is. So there's been times that I have gotten out of work 5:30, got dressed, went to the parking lot, and drove to the beach within 15 minutes, and actually hung out the beach for a few hours. It is very possible to do that many days per week. You could actually see this bridge here off to the right. You can see how there's not a whole lot of traffic. This is actually one of the least congested areas of the city. So you could actually get from work to the beach if you want very quickly and paddleboard, surf. A lot of people surf. I enjoy surfing, fishing. There's a lot of water life here that people enjoy. And because of that, that's a big part of the hobbies that we do here. We also have the largest park system in the country, public park system in the country. Adaptive surfing. So this is Brooks, one of their adaptive sports. Reasons not to apply. So hurricane. So believe it or not, we've had one Category 2 hurricane in the last 50 years. So we're actually probably you can't see me, but I'm actually knocking on wood right now. We haven't actually seen a Category 2 hurricane in about 50 years. It's the way that the shape of Florida is put together. New York has had a more recent Category 2 hurricane than Jacksonville. So that's not a good reason. But there are some. So if you have geographic restrictions that just don't allow you to come here, understandable. If you need a large class size, we will probably expand at some point, but that's not likely going to happen within the next year. So it's going to be 2 for your class. We are still a relatively young program. We are still doing process improvement to make the best possible program that we can. There's no reason why we should not be an exceptional program. That's our standard. That's the standard that our residents have set for themselves. So they're a big part of process improvement and ensuring that that's where we get. And if you don't signal, honestly, I wouldn't apply. I'm trying to save you money. If you send me an application, I'm going to review it. The last 2 years, I've reviewed every application that gets sent in, but we have 30 interview slots. So it's just logistically, it's just difficult to interview everyone. Tons of good applicants out there. I would signal if you're interested in the program, honestly. So what questions?
Hi, Dr. Evans. Good evening. I don't know if you can hear me, but I'm a fourth year medical student from VCOM, Virginia. Marion, I just wanted to ask of the PGY2s now, what have they mentioned to be something that they can tell incoming residents that they're most proud of the program as of right now?
I would say probably the process improvement part of it. You know, we are dedicated to being the best. That's the standard I've set. We have one of the best inpatient rehab units in the country, tied to one of the best hospitals in the country. So there's no reason we should not be among the best in the country. They are an enormous part of what they're pioneers. They're going to be an enormous part of what our program becomes. So because of that, every 2 weeks we talk, so we are constantly looking at the process. We've put a curriculum together. We have done our very best to make the best possible program, but there's only so many things you could anticipate. So they're actually living it now. They're just starting their PGY 2 year. So it's an important time period. This is probably going to be the most challenging time period that any of our residents will ever experience because of their contributions. But I would say it's probably the feedback with the program and just the commitment to seeing that we get everything right.
Okay, thank you.
You're welcome.
Dr. Evans, thank you so much for this presentation. I'm just going to read the first question in the chat. So she says, Kate Fallon says, does Mayo Florida PM&R support resident research? Are there ways for residents to get protected research time?
Yeah, so there is built-in research time for many of our rotations. We actually had a didactic today on research. So yes, you get research lectures as a PGY1. I didn't really get into the PGY1 program, incredibly strong PGY1 program. By the time they even make their way to us in PGY2 year, they're actually relatively strong in research because of their experience in PGY1. But we have a lot of resources, not just in Mayo, which is unbelievably strong when it comes to research resources. But also Brooks, they have their own research wing. And because of that, the two put together, it just offers a lot of potential for research.
And then the next question is do you have any interaction with other Mayo sites?
So I'm good friends with the people in Mayo Rochester. It's a big family between the Mayo sites. We see them regularly. Dr. Prito, she helped form our curriculum with us. So we work together. There's no competition between the sites. I think the people that are interested in Mayo Rochester are different than the people interested in Mayo Florida. We work really well together, and we accept a lot of their medical students. I know when I was a resident back in the day, I rotated here in Mayo, Florida. I'm sure we'll have our residents rotate up there to get extra subspecialty exposure. And it doesn't hurt to get more exposure for letters of recommendation and whatnot. Avoid the heat in the summer, maybe. So yeah, we have a great working relationship with really both of the sites. Mayo, Arizona is actually getting their own program, so we're actually assisting them. We're kind of paying it forward and helping develop their program right now.
Great. And then we have about 30 seconds left. There's a question from Peter. Thank you for the presentation. How would you say your program values current interns and preliminary programs? reapplying and redoing an intern year. Have you matched any reapplicants in the past? Any concerns with reapplicants?
We have 30 interview slots per year. Honestly, it's probably because of that, we're probably one of the more competitive programs in the country when it comes to actually getting an interview, because we just have so few slots because we have 2 per year. I believe we've had 1 reapplicant interview in the last 2 years. It's not that we're discriminatory. We would be happy to invite them in. That's just the way the numbers have played out. The same would apply with international medical grads, DO, MD. I'm a DO clearly. So we just want to take the best applicants that are passionate about PM&R and fit well with our program.
Great. Thank you so much, Dr. Evans.